Hello and welcome to National Herald. I'm Rukmini Sen. Joining us is Dr. Debra Brennessel from New York City Health Plus Hospitals. She is an infectious disease physician and a COVID-19 expert today. Welcome, Dr. Brennessel. Let me also explain to my viewers that New York City Health Plus Hospitals is the largest public healthcare system in the United States. They provide essential inpatient, outpatient, and home-based services to more than 1 million New Yorkers every year in more than 70 locations across the city's 5 boroughs. Their 11 acute care hospitals provide top-ranked trauma care, dozens of inpatient specialties, and mental health services, making communities healthy through a robust network of hospital-based primary care services for children and adults. Welcome, Dr. Brennessel. You must have heard about what's happening in India, that it seemed that we were doing fairly well in the first wave, although it's debatable. But in the second wave, we seem to have completely lost track. My first question to you is, how are you in New York City right now? How are the health experts, health workers in New York right now?
First, let me extend my concern and my prayers for my friends and my co-workers who now live in India, but also for the nation that's struggling so right now. New York is actually in a very good spot right now. We're really have gone beyond our second wave, and the number of patients getting admitted to the hospital and showing up, and even our positivity rate in our testing centers is much lower than it had been. So we're comparable now to last summer, last July. After the holidays here, after November, December, January, we had our second wave. So we're back down. It's not gone. We still see cases. The good news is that we're not seeing the same death rate that we saw back last winter, spring, March, April, when the city witnessed, the whole country witnessed a very high death rate. So it's still here. It's still smoldering. All it needs is a little fuel and it will start coming up again. I think our main concerns are some of the new variants, the variants of concern. We're trying to keep a track of that, but it's difficult to test every positive case for those variants. So I think what I heard from you, which is important and helps us tremendously, is we have multiple tiers of public health coming from the federal government, of course, with the CDC and then NIH doing a lot of the basic recommendations. And then in the US, the state governments then have their own public health support, and they make recommendations for the state. And New York City, where we are, part of New York City Health and Hospitals, has its own recommendations. Most of them agree with each other, but some are a little bit more conservative and some are a little bit more progressive. So right now, that's one of our pluses. But when we had our most terrible time was last April, May, we were not prepared. We were concerned about having too many patients entering the hospital, not having enough support, and staff were getting sick. So we had a lot of call outs. We didn't have enough staff sometimes to take care of patients. We were always worried about space, where we were going to put the patients. We were worried about oxygen. Fortunately, we were able to, ramp up our oxygen supplies. We were worried about personal protective equipment like masks, respirator masks, goggles, gowns, etc. But the hospital itself and the city of New York ramped up as quickly as it could. New York City expanded beds by opening up pop-up beds at the Javits Center, for example, and some other places to expand beds. So we had the boat that came into the harbor. I'm blanking the name of it, but to help expand for beds, because that was the main concern, and probably explain why we had such a high death rate back last winter. So one of the concepts in epidemiology when there's something like this, an outbreak, is called flattening the curve. So you want to make sure that your support system, the healthcare system, supplies, et cetera, are not exceeded by the demands of sick patients. So there may be as many patients in a longer period of time, but the peak of the curve is flattened. So we can always take care of those patients, but it may take longer to get to where it becomes more comfortable. And that's what we've seen in the second wave. In the second wave, we've managed to maintain our staff, maintain supplies. We looked at things more globally across the city, which hospitals had more beds, which ones didn't, and we could move patients to be upfront to make sure that we don't ever exceed our resources. On top of all of that, of course, we've had vaccines, and vaccines have made a huge difference. The US has started vaccinating under the emergency use authorization in about mid-December. And, we hear from our president that he's aiming for 70% of adults to be vaccinated with at least one shot by July 4th. The city of New York, it's around, I'd say 50 to 60%. We are really now focusing on campaigns to get more patients, more population, even non-patients vaccinated. We just yesterday started vaccinating the 12 to 16-year-old group. So, the whole idea is we need to open up again. We need to feel safe. Vaccine works, but there is a concern about these new variants. So that's where we need to be focusing in New York and at the hospital, is increasing vaccination rates and watching out for breakthrough infections for people who have been vaccinated, because they may represent the new variants that are emerging or coming in from overseas or from other parts of the country.
How did you prepare for the second wave? Because there must have been a planning and strategy. What was the strategy exactly?
Strategy was to put our emergency management plan together, look at personnel, look at supplies, look at space, and try to be preemptive about, if we have this many patients, this is what we do. If we have this many patients, this is what we do. If we have this many patients, this is what we do. And how to maintain a healthy staff. So it was very important to get the message out because in the first wave, a lot of staff were quarantined. They may not have gotten sick, but they were exposed and they couldn't work for 14 days. Not having that staff made a huge difference in how we could take care of patients. So maintaining the do not come to work if you're sick, because sick employees will get other people sick. Make sure you always have your personal protective equipment on for the right area that you're working in, particularly face cover and taking care of patients' eye cover and hand hygiene and gloves. But even when you're outside, the same thing pertains. You cover your face, you wash your hands. So don't come to work if you're ill, if you have symptoms, or if you're obviously quarantined. Personal protective equipment, hand hygiene, very important, and social distancing. Some of the healthcare organizations in the country had outbreaks of COVID amongst their employees because they maintained all the precautions except when they took their lunch or their break, and then they were all in a small room with their masks off, eating and laughing. So even social distancing, even during times that you don't want to, but if you're going to be with other people and eating, you should maintain that social distancing of at least 6 feet apart.
A lot of our healthcare experts and healthcare workers are extremely tired. There's a lot of fatigue here. How did you take care of that?
That's an excellent question. Frequent appreciation. The city of New York and Health and Hospitals provided food for all employees during our last spring peak. So food was coming in 3 times a day. People didn't have to think about how was I going to get food? We can't use the cafeteria. People aren't delivering food. How do I eat? So they were supplying food. There were lots of outside donations. People were donating food, donating snacks, donating PPE, personal protective equipment, donating, T-shirts that you are a hero. So acknowledging that people were really working hard. In addition to that, our behavioral health team are supporting individuals and even groups of individuals who may feel particularly stressed, like ICU staff who are working 12 hours on, 12 hours off. Some of our staff weren't even able to be with their families and had to be put up in hotels because they were concerned about bringing COVID home to their families. So there was a lot of support, both structural support from the city and from health and hospitals, but also lots of volunteers, a lot of donations coming in to support the staff. We have a program here called Helping Healers Heal. And this is almost like a crisis unit that's already set up. So if there is an individual or a team or a unit that's particularly stressed or had an adverse event, a death that was very tragic and family couldn't come and be with their loved ones during their end of life, this, we call it H3, this Helping Healers Heal group can be mobilized and come and help with a debrief and have people talk about it, and just to let people know that they're not alone, we all care, and they're doing the best they can, and give them an opportunity to reach out again if they need to talk to somebody.
This leads me to another question that I was speaking to to a mental health expert here, and he was mentioning how we haven't addressed the mental health crisis amongst the children here, because the schools were closed down here for almost a year. They're still shut down, while the travel, recreation, hospitality was open, but children were still in their homes. What have you done in New York about children? How have you addressed their mental health and also containing infection in that group?
Well, I can't speak for all of New York City. I can tell you what my experience and what I've heard. So yes, our schools were closed. Virtual learning was happening. When public health sees that the rates are going down, they have offered parents hybrid teaching. So children may come of certain age, may go in 2 or 3 days a week, and then do the other learning online. But we do know that not being in school has had a terrible toll on our children. Not to mention that they're behind in learning. Their children, especially young children, school age, elementary school teachers, the classroom teaching can't be beat. Maybe high school definitely is different. College is different. Those young people know how to self-learn and turn in paperwork and whatnot. But the socialization and the discipline of elementary education has definitely suffered. We know across the country that some municipalities are extending the school year through the summer. There's no summer break because they need to catch up. They lost time. New York City hasn't done that. New York City is still in a hybrid situation, depending on the level of the classroom. But the children are terribly isolated. They're isolated not only from their classroom, their teacher, their friends, but they're also isolated from their families. Families have not gathered, they're not traveling. So that's been a huge problem. I think, this type of communication with Zoom or Skype or FaceTime helps, but not that much. I didn't get to see my new grandson for 14 months. After vaccine, I finally took a trip to meet my grandson. And it was, for my daughter in particular, I could tell she was very stressed because she didn't feel the family was around to help her with a newborn. So it's so many areas where mental health is taking a toll. We know because of people are out of work, that there's a tremendous amount of stress in families and depression, an increase in substance abuse, an increase in suicide rates. all happening because of the COVID, not just the infection, but all the isolation that's happened because of COVID.
If I may ask you, how was your vaccination plan planned actually? What was the stage? How did you like here? Of what I know, people with comorbidity, people
Yes.
who were 45 plus were offered the vaccination first. How did it happen there?
Yeah, very, very similar, just with different triggers. So the first thing was those over 65, anyone over 65, or anyone between 45 and 65 with an underlying serious disease like cancer or AIDS or, on rheumatoid arthritis, where if they got COVID, they had a higher risk of getting very sick. So that was the first phase. And um, that as supplies became more reliable and vaccine was becoming more acceptable, that opened up to any adult over the age of, I think, 45, and then every adult over the age of 18. And then with one of the vaccines got approval for the 16 to 18, and then just this week it's now 12. So we can vaccinate anyone above 12. But certainly for the first, I would say, 2 months, people were trying to make appointments because it's by appointment only. Initially, by appointment only, people were having a lot of difficulty making appointments online. There were just so many ways of doing it. Some places had a lot of vaccines, some places didn't. So especially our elderly population who may not be as savvy with using computers had a lot of difficulty getting an appointment for a vaccine. I would say at this point, now we're vaccinating for about 6 months. We can do walk-in vaccine. We don't see long lines. We don't have to have people making appointments on computers. There's actually vaccine now in New York City at pharmacies. The commercial pharmacies can give vaccine, which wasn't there in the beginning. There are pop-up vaccination sites in areas where there's a low, where it's difficult for people to get to vaccine, and to try to address some of the disparities, the economic and racial disparities. So right now, vaccine is, the pipeline for vaccine is very strong. And our focus is try to get those people who were having difficulty and want to be vaccinated, let's get them in. And the next priority is the people on the fence who might do it, but didn't do it. How can we convince them that it is safe and efficacious? And then the next barrier will be those who don't want any vaccines. And there's always some of those in a population, right?
I was reading your website, and I figured that there are mobile units being sent to people who are homeless in
Yes.
the city, and you're offering them vaccination and other healthcare services. What are you exactly offering them along with the vaccination?
So they're being offered social services, so housing options. They're being offered if they have mental health issues, a mobile crisis mental health person. They're being offered food services if if they have no food, how to find a food bank within walking distance for them. So it's more or less social services and options for coming into care for their substance abuse or mental health issues.
If I may ask, I'm sure that you're kind of expecting a third wave and fourth wave. Are you? And how are you preparing for that?
Yeah, if you know the U.S. news, yesterday the CDC, Center for Disease Control, announced that they are they're stating that if someone is fully vaccinated, that it's not necessary to wear facial covering or socially distance in certain situations. Certainly in like airplanes and public transportation and hospitals and nursing homes and in schools, they're still recommending full precautions. But if you're out, in the park, or you're, out at dinner and you've been vaccinated, they're saying you don't have to wear a mask. And some of us are concerned that, we don't know who's been vaccinated and who's not. We don't have vaccine passes in the US. That I don't think we will ever have a vaccine pass. But and we can't force people to be vaccinated because it's still under emergency use. Healthcare can make it mandatory once it's licensed, like we do for the flu, but we can't do it at this point. So there's a concern that people are going to take their masks off because the CDC said you don't have to wear a mask, but they don't know who next to them is sick and who may be carrying a new variant, even if they've been vaccinated. So that is my concern, is the variants of concern. There may be new variants that our current vaccines don't cover, and they could spread like wildfire. We know that the new variants tend to be more communicable, more infectious. They may not be more deadly, but they may be more infectious. So I think we will have a third wave. How are we preparing for it? Very similar to the second wave. We have to watch our positivity rate and our testing sites. We have to look at the volume of patients coming into the emergency room or the clinics who test positive or have symptoms. So keeping an idea of the metrics or the numbers is very important. Again, getting the word out to be vaccinated. If we get good herd immunity, and I think you've heard that term, so if 70% of the adult population get vaccinated, the emergence of these variants is very much suppressed. But if we don't have herd immunity, there's so much virus in the community still. The virus is always a step ahead of us. Mutations happen all the time. But if we can keep the number, the density of the virus down, the virus doesn't have enough bandwidth to emerge with a resistant strain. So we're doing the same thing we did the first time, which is to keep an eye on those metrics, offer the vaccine and recommend the vaccine, not even offer, but we recommend everybody get vaccinated, and make sure that we still maintain our precautions, hand washing, face covering, and social distancing as much as possible.
This is my last question. I'm sorry I've taken a lot of your time, and I'm sure you have a busy day ahead. You explained in the beginning of this conversation that it's a multi-layered, it's a multi-tiered system, this whole public health system in New York City. Can you explain a little more? What is it all about? How do you, I understand how it works in India, but how does it work there?
Again, federally, at the US federal government level, the Center for Disease Control and the National Institute of Health, that's the scientific pool that analyzes data and research and whatever and makes recommendations. Of course, the federal government has to agree that their recommendations should be, sent out to everybody. But the states all 50 states have their own Department of Health, and they will look at the recommendations. They will look at their own positivity rate and their own hot zones, so to speak. So it's very different in New York, for example, than in maybe a small state like Delaware or Rhode Island. The density of the population, the number of people coming in from overseas. So the state makes their own recommendations based on their data for their state. And then the city of New York, which is obviously a high density population, many immigrants coming in and out still, has to make their own recommendations to the public. Usually the state and the city will agree, but sometimes they don't. And we have to abide by the city, which is usually the most conservative, and the state, and then the federal government. But we have to abide by our local recommendations or requirements first for reporting, for recommendations for treatment, for PPE, for social distancing, for the school separation. Sometimes we hear that 3 feet is enough between desks at school, but New York City still has 6 feet. So will they get to 3 feet? Maybe, but it depends on the data. how many kids are getting sick, how many teachers are getting sick, how big are the classrooms, how, so it really depends on what's happening in a local level, but the initial guidance is coming from the federal government.
One last question. I'm
Sure.
sorry, because it's an
That's all
important
right.
question, keeping in context our situation here. Did you bring in new healthcare professionals between first wave and second wave? Did you train new people? And did you, for instance, there are only so many hospitals. So did you create spaces which work like hospitals for the second wave? Because looking at the numbers of infection,
Right.
was there any?
So we didn't need to do that for the second wave because the curve was flattened. We didn't overwhelm the resources, and we learned that we should transfer patients earlier and not have one hospital or one part of the city or one city even being overwhelmed when others are just waiting and don't have enough business. But in the first wave, definitely, not only did we recruited volunteer nurses and doctors and respiratory therapists who were retired, and we gave them emergency privileges to help us. There was an emergency medical corps that New York City also recruited, people that were already volunteering. And there also, the federal government deployed National Guard health, nurses and not social workers, but nurses, respiratory therapists. So we had at one point coming to us over 150 people from the military deployed here. That was the first wave. And honestly, we couldn't have done it without them because many of our employees were also sick or in quarantine. So our number of employees went down dramatically while our number of patients went up. But after May, June, all of those resources kind of went back home. And in the second wave happened across the whole country. The first wave was really New York City and the borough of Queens, where our hospital is. We had the quickest rise and the biggest peak. But second wave went all over the country. So there were other places that needed those resources, but we were already prepared by then to make sure we used all of the things that we knew we should have done in the first place, which is don't come to work if you're sick, use your PPE, wash your hands, social distancing, etc., which made a huge difference. And now with vaccine, probably making even a bigger difference. So we did not, for the second wave, have to deploy. We did transfer patients out. So there was something called load leveling. So the New York City Health and hospitals would huddle in the morning with each other and see which hospitals could accept patients that had empty beds and which ones had patients waiting in the emergency room. And they could kind of work out who could be transferred to keep the demand at a level where they could be handled by the current resources, the supplies, the staff, the space, etc.
Thank you very much. I'm sure we will get a lot of help from all the information you've shared with us. And thank you for your time. I know it's early morning there and you made time for us. Thank you very much.
You're very welcome. And again, my thoughts and prayers are with everyone in the country. I think if you all put your heads together and look at resources in a broader sense, that you'll get through this wave as well. Vaccine is available now. Encourage your population to get vaccinated. It will cause the biggest decline and get things under control.
Thank you very much.
You're very welcome.